In order to eliminate inflammation and to get reduction and elimination in chronic symptoms, you must firstly remove the source. This is not taught in the traditional system, which is why many people with chronic pain exhaust their options just to find out that their pain is still there in the end. The most common source of inflammation for the average American is the standard American diet. And the most common sources of that inflammation in the diet are in things like processed carbohydrates and sugars, vegetable and seed oils, trans fats, processed meats, excess alcohol, gluten, and dairy. But what if we took all of these things and replaced them with foods that we know can help reduce and eliminate your chronic pain? You know, it's a common misperception that you can't eat healthy and still enjoy it as well. But that's just not true. You can use food as medicine and enjoy the food. We just need to know what we're looking for. Let's address the top traditional methods people exhaust and why it's not working for your chronic pain condition. Number one, ibuprofen. It's used to help turn down inflammation temporarily, but because it doesn't address the actual source of the inflammation, it's like trying to put out a fire that's being fed by gas without turning off the source of the gasoline. As soon as you stop putting out the fire with the ibuprofen, it comes back and you're still left with the original problem. Ibuprofen is cheap, but it doesn't address the root cause, and it can affect your stomach, your guts, and even cause ulcers. In fact, in the United States, over 15,000 people per year die just by taking ibuprofen and medications like it. Number two, prescription medication and opioids. You're prescribed medication because you have a problem and you need the relief. But unfortunately, this can lead to medication reliance and even addiction. Because painkillers are limited, many people with chronic pain even resort to heroin because it's actually cheaper and easier to get on the street long term. According to drugabuse.gov, 128 people in the United States die per day from overdoses that started with a legitimate chronic pain issue and were prescribed a medication that eventually led them down this path of opioid addiction. This is unfortunately where the pain medication ends up taking people's lives. Not to mention with insurance, you're paying $100 or more per month with prescriptions that don't actually fix the problem. Number three, surgery. You're going to spend $5,000 to $15,000 per surgery depending upon what your insurance coverage is. If we're talking about joint pain, your options are arthroscopic surgery, which is minimally invasive, or full joint replacement surgery, which in some cases is helpful, but in a lot of cases, some people still end up with having the same amount of pain that you had to begin with. So you went through all of this trouble and risk of the surgery, and in the end, it still didn't address the root cause of the problem. Doing nothing is also a choice that people make. They think that I can just deal with the pain. The pain's not bad enough, yet I'll just wait until it gets worse. But what people don't realize is that it will never be easier or more affordable to fix the problem than it is right now. If people don't make time for their wellness now, they will be forced to make time for their illness later. So doing nothing is not a great solution for chronic pain. If we don't understand how our body works and reacts to food, we will spend thousands of dollars and countless years on solutions that don't truly address the problem behind our pain. This can be very disheartening. It causes us to feel unworthy, doubt ourselves, blame others, and become spiteful. There's a cartoon of a person going to a doctor. It says, "We've tried all these other things. The last option is to try a natural alternative that has a 96% success rate." And you think to yourself, well, why did we wait till the end to actually take what's natural and has the highest success rate? By understanding how nutrition works in your body in relationship to your pain, you will not only be able to take control of your chronic pain, but you'll be able to take control of your life. You'll be able to be heard and become a true advocate for yourself. I want you to be confident in the decisions you make for your chronic pain, for your health, and for your life. Think about how our food supply system has changed over time. We were hunter-gatherers, then we moved into growing our own food at home, eating whole foods with the family around the table, and then we moved into industrialized and processed foods with on-the-go options. Over time, there has been a clear shift in what we consume, and it shows in our health. After years of studying, treating, and understanding chronic pain in its entirety, I have found that the best solution to the majority of chronic illness is using functional nutrition. Using food as medicine as a natural solution to address the root of chronic illness. Over the next 14 days, I'm going to teach you how to use food as medicine to strategically achieve optimal health, relieve and even rid your chronic pain naturally through visual lessons, action steps, and grocery checklists. I will teach you how to turn off the source of the inflammation so that you have long-lasting results and the pain doesn't come back the way it would have if you stopped using a bandaged solution like ibuprofen. If you commit to 14 days of watching these videos and applying these steps to your everyday life, you will undoubtedly see success by implementing the approaches that you will learn in this program. After doing extensive research on other educational material as they relate to chronic pain and functional nutrition, this is what I found. Little to none of them are focused specifically on nutrition as it relates to chronic pain. Other courses are hundreds, if not thousands of dollars, and focused on those wanting to teach chronic pain and not really those wanting to apply it to themselves. Most any other course you will find is likely going to be in the form of a pamphlet or a book, making it harder to digest and actually put into practice. You can use resources like YouTube, which addresses problems associated with chronic pain, but that can take weeks, even months, to gather all of the material, and even then you may not find specifically what you're looking for, or you will miss out on important material. Whereas in this course, I address everything you need to know, A to Z, on how to achieve optimal health and relieve your chronic pain naturally. This material can and will carry you throughout the course of your life. Anyone at any age can take this course and achieve optimal health. It's important that we take control of our lives now before it becomes too late. Making lifestyle changes isn't easy, but it is possible and you can do it. You will have bad days, good days, and really great days. If your chronic pain is a real problem, this is a real solution. Each day in this course, you will have access to visual content that is easy to understand and apply to your everyday life. Day 1, we cover the basics, using food as medicine, why it's the best solution, why we have to use this solution to address the root of our chronic pain. Day 2, the anti-inflammatory solution. We will discuss inflammation, how it contributes to chronic pain, and introduce the most common sources of inflammation. Day 3, hidden sources of sugar. We will discuss sugar, which is one of the biggest contributing factors for inflammation for most Americans. Day 4, failure to plan is planning to fail. If you don't have a plan, you will likely not succeed. In this lesson, we will be discussing planning strategies. Day 5, sugar and the mind. Sugar can affect brain function as well because it is addictive. This can make it difficult to reduce or eliminate sugar. In this module, we will review the details and talk about how to get sugar out of your life. Day 6, insulin resistance and testing. If you want to know your blood sugar status, this is the lesson for you. We'll discuss how to know if you're actually having a problem in ways that your regular doctor likely never talked to you about. Day 7, hydration and beverages. Water is life, and in this lesson we will talk about what you drink, not just what you eat, and how that can also have a huge impact on your chronic pain. Day 8, healthy snacks and carbohydrate swaps. Most people understand that they need to make some changes in their diet, but they get stuck on how to make substitutions for their favorite snacks. In this lesson, we'll make it simple. Day 9, not all fats are created equal. We have all been taught that fat is bad, but guess what? Doctors used to recommend smoking. Science evolves as we get a better understanding of how the body works. In this lesson, we will discuss how fat is actually critically important to your overall health. Day 10, alcohol and the gut. Alcohol can be a mixed bag when it comes to its impact on your health. We will stick to the facts and talk about how alcohol can impact your gut, which can impact your chronic pain, for better or worse. Day 11, organic versus non-organic. Lots of people are skeptical and think eating organic is a gimmick. If that's you, you're in good company. I was there at one time too. In this discussion, we will unpack the debate organically. Day 12, understanding gluten. Is it just a fad? You'll have to dig into day 12 to find out. Day 13, why avoid dairy? Let me just ask you a question. What other mammal on Earth drinks another mammal's milk? And day 14, a review of it all. 2 short weeks and you'll have all the information you need for your journey. We'll review all of the key details and help you get started on your path to a pain-free life. And bonus, we will be adding to this course over time, and you will have access to all of the new material for life. You will have instant access to our private Facebook community where you will have a family of supporters who are working together to relieve and rid their chronic pain naturally through functional nutrition. There will be live Q&As and webinars, and we will take your feedback and build on this course based on recommendations and questions within the private community. Whether you have chronic pain now, know someone who does, or have dealt with chronic pain in the past, in this course you will learn the fundamentals in using food as medicine so that you can be confident in your health and future and live the life you want to live, free from worry, free from pain, and even things associated with pain like anxiety, depression, insomnia, and fatigue, just to name a few. So now you are faced with a choice. Leave this video and remain in the same situation for years to come until you are actually forced to make a decision. Or take control of your life now. Make this drop in the bucket investment, one that will truly make a difference in your life. If you want to learn proven, natural solutions to relieving and ridding your chronic pain, click the link below right now and join the family. Once you click this link, you will be asked to fill in your information and you will have instant access to this course for life. Immediately after joining the course, watch the welcome video found inside the course funnel for the next steps on what to do. I have seen too many people suffer needlessly with chronic pain. Don't continue to let yourself be one of those people. Instead, make the decision today to invest in yourself so you can get back to living life on your own terms. I look forward to seeing you in the course, giving you the tools you need to be successful, and sharing in your victories as you embark on this life-changing journey.